Hi everyone, today I will be doing a static scapular analysis. Okay, the reason why I'm checking because I would like to find out whether my client has a neutral position of the scapula. Your scapula provides anchor or provides stability for your shoulder joint. Your scapula should be able to move in all directions. Okay, so first I would like to check whether his scapula's lie flat along his back. So if the scapula lie flat, that means there's no winging nor anterior tipping. So I line my hands along his back. I notice that his left side seems to be okay. The right side has a little bit of winging here. The whole medial border of the scapula sticks out. Okay, so right side winging. Then I would like to check further whether his scapula has any elevation nor depression. The way to check is I will compare his superior angle of his scapula with his thoracic vertebral disc number 2, whether they are level. So the way to find his superior angle, I ask him to bend one of his arms. So you notice when you bend your arm behind your back, you can see that the medial border sticks out more, so you can locate the top of his scapula, which is his superior angle. Once you find it, you can ask him to bring his arm down. Now we're going to try to locate his thoracic vertebral disc number 2. The way I find it is I ask him to bend his head down, lower your chin down towards the chest. I try to find his T7. Okay, so I think this would be his C7, which is the bottom of his cervical spine, and ask him to keep his head down and turn your head side to side slowly. So I notice that this would be his C7 because this bone doesn't move. Then you can bring your eye line back up. I slide my hand down and I find the next vertebral disc or spinous process. That would be his thoracic vertebral disc number 1. Then the one further below spinal process would be his number 2. So I compare his thoracic vertebral disc number 2 spinous process with his superior angle. It seems to be level. So that means he has no elevation nor depression of his right scapula. Okay, I will do the same thing on the left scapula as well. Now, I will also check whether there is any protraction or retraction of his either side of his scapulars. So I would ask him again to bend his elbow so I can find his medial border. Okay, this is his medial border. So then I ask him to bring his arm back. And then I try to find a distance between spinous process and the medial border. So this distance, I want to see whether it is about 2 to 3 inches, okay? So the way to check is usually 2 to 3 inches is about the body distance, right? I check his 3 fingers is just slightly bigger than my 3 fingers. Okay, then I compare here. Usually it should be about 3.5 fingers as mine, but it seems that the distance between his spinous process to medial border seems to be more than 3.5 fingers of mine, so his right shoulder blade is protracted. Okay, if it's less than 3.5 fingers, then it will be retracted. So you will do the same on his left scapula. Next, I also would like to check whether there is any upward rotation or downward rotation of his scapula. So we have already found his medial border here. We have already found his superior angle. Then we're going to find his inferior angle, which is the bottom angle of his shoulder blades. We want to see whether these stack directly above one another. It looks like his inferior angle is moving slightly out, away from the center of the spine, okay, indicates an upward rotation of his right scapula. You will do the same thing on his left scapula. So to summarize, he has winging right scapula, protracted right scapula, and upward rotation of